everybody for joining us today. I'm going to go over a quick startup presentation before our professional gets started. We are so excited to welcome here today. So yeah, as everybody is coming in, welcome to Pre-Health Shadowing. So we are a student-led, an international student-led, women-led, minority-led nonprofit organization that is focused on the progression of medical education, especially during this time of COVID-19. So just a little PSA, we do have closed captions for all of our sessions to accommodate students with disabilities. The setting is available at the bottom of your Zoom screen. And if you need assistance enabling the closed captions, please go ahead and direct message me or one of our other team members here today, and they can help you with setting that up. We are always looking for ways to be more inclusive, so to ensure our sessions are available to everyone. So please, if you have recommendations on how we can improve on that, email us at info@prehealthshadowing.com. So we have students calling in from all over the world, since this is an international nonprofit. So if you could please drop in the chat where you're Zooming from today. Awesome, we've got people from all over. So if you would like to stay in the loop with Pre-Health Shadowing, make sure to follow us on social media. We are active on Instagram and TikTok. You can also sign up on our website for our email list and make sure you get notified every time there is a session and get the weekly schedule of upcoming events. So being a part of Pre-Health Shadowing, that means you have some awesome opportunities available to you. So just to introduce you to them, we have, first of all, partnered with Kaplan to get you guys a 10% discount, that code that can be used on all Kaplan courses. And we also have given you a way to get free study guides for the MCAT, GRE, TCAT, NCLEX, and other standardized tests that you may be taking upcoming. So we encourage you to fill out the survey we just dropped in the chat in order to get signed up for the Kaplan email list and all of the great resources that they offer. So just take a quick survey and we'll sign you up. We would also like to draw your attention to another amazing program, which is Neolist. Neolist is an online mental health platform for students. And we all know that young adulthood and college is stressful during non-pandemic times. And for pre-health students especially, we know that this path isn't easy. So we've partnered with Neolist to give you guys free access to their services. If you use the link in the chat or enter the code PREHEALTH when signing up for Neolist online, you can get in for free and make use of some of their amazing resources. So another partnership or another company that we've collaborated with is Mask for Mask, which is a woman-led organization that is donating 4 masks for every 4 masks sold during the COVID-19 pandemic. These masks go to people in need, such as people in the homeless community, healthcare workers without enough PPE, and just in general, anyone struggling to stay safe during these times. So if you use our code PHS15, you will get 15% off at checkout. And also, you'll be helping us because 10% of the proceeds will go to PHS, which is amazing because we are a nonprofit that runs solely off of the support and work of our students, and we appreciate all of the funding we can get. If you want to play a bigger part in supporting Pre-Health Shadowing, we would love for you to join us in our network of student volunteers or team members. You can apply to be a part of our administrative team and be up here with us. If you go to our website, and you can lead students in various projects and get involved with your own initiatives. It's really great, it's fun, and you get to connect to a lot of your peers. But we do understand that we are all pre-health students and we don't always have the time. So if you are looking to help out but don't have a ton of time to spare, you can sign up to be a volunteer on our website as well. That will enable you to help out with projects such as grant writing, research, data analysis, social media campaigns, but still do it on your own time, at your own pace, and do it asynchronously. So if you're looking to get involved with this, go ahead and join and check it out on our website. If you are a high school student specifically, you can definitely get involved with us as well. we have started a new program called HCP, which is High School Training for Pre-Health Shadowing. And this allows pre-college students to get involved, network, and get introduced to medical and paramedical opportunities they may be pursuing in their future. So if you are a high school student, go ahead and follow that same link to sign up to be a volunteer with us and indicate that you're interested in HCP when you do so, and we can get you involved with that. So we always want to recognize the hard work of all the students that are involved in this program. So if you're interested in getting published, you can submit essays, reflections, research papers, and reviews to our editor-in-chief, Taha, who is going to be one of our wonderful co-hosts here today. The link is in the chat, so go ahead and use it to submit any of your writing. It will look great on CVs, applications, resumes, etc. So I would advise that you take advantage of this. So let's talk for a second. Diversity is a huge part of our program, and we value it so much. So one of the things that we've been doing is we're looking to host regular monthly workshops surrounding diversity. For example, next month will be Women's History Month, and we're going to be hosting a women's panel to talk about professionals and patients that are female and what they have dealt with in the medical field. So if you have people who inspire you and you want to see them on one of our future diversity boards, go ahead and nominate them using the link in the chat. It's great to be able to kind of get those people out there, those mentors that you have, but then also come to these diversity panels and meet other mentors and meet other students who have the same kind of like-mindedness as you. So please go ahead and use that link if you know some amazing professionals that you want to share with us. So if you can, we humbly ask that you donate to our program. As I've said, Pre-Health Shadowing is an entirely student-run organization, and we are working around the clock and around the world to keep this free and accessible to everyone. Unfortunately, Zoom and our website are not free, and any contribution you guys can give would be greatly appreciated, even if it's just $1 or $2. But we understand that not everyone's financially able, and we don't expect it from people. But we do ask that even if you can't personally contribute, that perhaps you send this link to somebody that you think can. Throughout the session today, we invite you to drop your questions in the chat, because our co-hosts, Taha and me, will be asking questions later during the Q&A portion of the session. So go ahead, make sure you drop some interesting questions, things you're thinking about, just general advice you want, anything in the chat, so our hosts can get to that later. Additionally, we encourage you to take good notes, because we will have a post-shadowing assessment that will be available after today's Zoom session. So you can take it in or your virtual shadowing certificate that verifies the hours today you've earned. So I'll go over that more at the end of the session, but stay tuned and make sure you're paying attention. Last but not least, we request that you please turn your cameras on if you can. We understand it might be a privacy thing, you don't have to, but a little face-to-face can go a long way, and we are all, kind of isolated. Get to know each other better and make it like a real shadowing session. So thank you guys for listening to my little spiel, and I would like to invite our professional to go ahead and start sharing his slides, and we can get into the presentation.
All right. I'm just having a little trouble. Hold on.
No worries, you're all good. We got the polling question up. Wonderful.
All right. Do you see it?
And it's still loading up, please. All right, it's still loading up. If you have not yet submitted the polling question, go ahead and do so. We'll be closing it in just a moment. Just a little bit on the questions. Virtual shadowing does have, we do have volunteering hours. We also do have flexible and accessible volunteering hours. You can volunteer on your own time. So if you guys are interested, you can sign up on our website. All right, I do not see the screen, but go ahead and comment in the chat if you're able to see the screen. It might just be on my end.
Are you
Okay.
guys able to see?
It looks like we're not able to see
No?
the screen.
Okay, so let me try, because it's saying I'm sharing my screen. All right, let's see. Hold on. Let me try again. All right. No?
No, it doesn't look like it. Okay, let's see. Muntaha, could you perhaps share your screen with the slides? I believe you sent your slides into.
Yeah, that will work too.
Okay, wonderful. I will, Muntaha, if you can go ahead and pull up the slides. I'm going to go ahead and release another polling question regarding your knowledge of today's virtual shadowing session prior to the presentation.
That's a good question.
Wow, it's pretty split. We have 33, 41, 27. All right, I'm going to leave it open just for a couple more seconds. If you've not yet had the opportunity to submit it, go ahead and do so. All right, I'm going to go ahead and release it. So we have a very small majority of no's.
All right.
Awesome.
All right, so this is going to be a good presentation. I'll make it worth your while. Thank you for tuning in. I'm really excited to be sharing my knowledge and my experience and my passion with you guys. I've always, I grew up just like you guys, working hard in school and had a dream, and was able to, be persistent. And I really gave, planned, and I really gave it my all. And sometimes I've been out of practice now for almost 11 years. And it really, when I look back, time flies. So it's really important to enjoy every step of the way, especially this step, and enjoy the people that you meet in your class. Because later on in life, you're not around as many people, you're around the same group or office. So there's a lot of perks to what you have. This is optometry. They have the wrong PowerPoint. Yes, okay. So a little bit about myself. I, as a periodontist, basically you're a dentist first, and then you go 3 more years of training to be able to do more, diagnose more, and it's more of a surgical aspect of the career. My mentality is I'm always trying to be better than I was the day before. So I will always learning, always learning from all sorts of people. People who shadow me, I learn from them. People who I shadow, I'm learning from. It's just always a constant learning experience. So you have to be really open, because you never know who will be your teacher. It's not just the mentor that's your teacher. It's your friends and the people in your class, and your younger siblings even. So always aim to be better than the day you were, the way you were before. I received my Bachelor of Arts in history. So I actually did all the pre-dental classes at UCLA. And in addition to that, my last year, I wanted to just do something that I was probably not going to have the opportunity to, for the rest of my life, really delve into. And that was just history, knowing more about the past. That really made me, I feel, well-rounded. So these history classes, they're usually much easier than the science classes. So I was taking like 5 of them every quarter at UCLA. And I I worked at volunteered at the UCLA, the Periodontics department. And literally, like there's a list of places in the hospital that they asked, where do you want to volunteer? And for some reason, I was just drawn into that word. And here I am later. I was probably like 19 years old at that time. And I am now that thing that I pointed to as my volunteer, really my first experience in dentistry was in that department. I went to UCLA also for dental school. I had done research when I was in undergrad, and that's one of the best ways to get connections, and it's from doing research, and all of the researchers there. It's a very small community, really, and it opens up doors, and you get to meet a lot of people. And so after UCLA, it was a 4-year program, very tough, very didactic. The clinic wasn't as strong as some of the other dental schools, I would say, but it was didactically really strong. I studied a lot. It was just constant every day. You were just in the library and you're studying 7 days a week, nighttime, daytime. I really, I gave it my all when I was in dental school, especially the first couple years before you take the boards, is when it's really important to give it your all. And one of my things that I like to do is whenever I start something, I like to start it really strong. So first 2 years, library all the time. If we could change the slide. Yeah. So after that, I got into USC, which is another dental school in Southern California, and I entered into a 3-year program there, where really periodontics used to be 2 years, and then they added a 3rd year. It changed from really being gum surgery to incorporating dental implants, people who are missing teeth, and really rehabilitating people's mouths, being able to provide them function and aesthetics for people that are missing a lot of teeth and have really worn down and hopeless teeth, and taking out their teeth really all in one appointment. You can really transform people's smiles. So we learned how to do that, how to think. USC really polished me, because it really, I learned all the information maybe in dental school, but I was able to process and put it all together at USC in my residency. While I was both at the UCLA and USC, I had done research and I wanted to publish it, and there was no one that wanted to take it. No one wanted to publish it. No one wanted to have anything to do with an undergrad. So this is one of my mottos, is I like to predict the future by creating it myself. And so I said, why not just create my own journal, and that way I could publish my article. And it turned out to be, 13 years later, I think 14 years now later, the UCLA journal is still going on strong. And same with the USC. Then I went after USC, and I also did the same thing there, because I saw that there was a need for it there. And who would have ever thought that someone like me, that I wasn't really research oriented, I didn't like research. We had a class that was called evidence-based dentistry, and I was not paying ever any attention in there, and it was just not a good fun. When you think of research, you don't think of anything fun. And just more recently, I've been doing a lot of research, and I am the editor of one of the dental journals, and I'll talk about that a little bit more. But you just never know where your career and life goes towards. I used to lecture a lot more. Then I had I have 2 kids, and they're 4 and 2, And so it's been a little bit difficult lately, but I love to do these kinds of things. And with Zoom, it just makes it so much easier to be able to do these things. Uh, I also, and I'll talk about this later, founded a dental specialties like myself, oral surgeons and endodontists and periodontists. I co-founded a company that basically manages our lives. And it's the largest agency for traveling dental specialists in the United States. We hire really in place and give opportunities and find opportunities and work with specialists around the country. And I started that about 6 years ago, and it's really recently, I'm more of a silent partner now, and it's definitely, uh, grown to be really special. Also, more recently, this past year with COVID, I was able to, during the time that I was at home, not doing anything and not working, because I really, about for 2 months, I didn't see any patients almost. I started researching, and I put together an article called the Mouth COVID Connection, and it ended up to be a very well put together article that went really viral around the country and world, where the first ideas of uh, the gums in the mouth being connected to COVID severity. And when people go to the hospitals, they have a higher chance of going on a ventilator. And it's fully described. And that could be found on my website, drmolayem.com, or it's also on mouthcovid.com. And it was one of the most read articles of 2020 in dentistry. Okay, go to the next slide, please. What made me choose this career? This I always wanted to be a doctor, and I have one uncle that's an orthodontist that does braces, and I have another uncle from my other side who's an orthopedic surgeon. So if you just take those two and put them together, it's pretty much what I do, which is kind of interesting, doing surgery in the mouth. My grandfather was a really big influence on me, and and also my brother. My brother is a dentist, so a lot of dentists in my family. I would say that's probably a big influence. I went in the doctor area, and then within there, it was dentistry, and the fact that I get to work with my hands, get to do these procedures that I have control over, and I could make people feel better right then and there, versus writing a prescription and hoping they take something to get better, which is amazing too. And actually, I'm circling back, and I'm doing some more medicine, um, uh, naturopathic type of functional work right now. But I really love surgery, and uh, it's not for everyone. It's not easy. It's backbreaking. When you're a surgeon, you're usually in long procedures. You're, back-to-back surgeries, and it could take a toll on people. So it's not for everyone. And of course, you can make your schedule light, but sometimes depends on where you work and if you work for someone, your schedule may not be light. And so you have to be really focused when you're doing that. And this field, it's basically, in almost any field, is constant learning that's needed. Also, long-term and stable career. I wanted something that was stable, that was something that was, you can pick up and take to any country really, and do. Okay, next slide. So what is a periodontist? Really, a periodontist is a dentist that specializes in preventing, diagnosing, and treatment of periodontal disease. Periodontal disease means gum disease. Perio means around. Dental means the tooth. So we're working around the tooth. And what's around the tooth? The gums and the bone, the jawbone that holds the tooth. And sometimes when there is disease, the tooth becomes loose and we have to remove it, get the area ready, and put a dental implant, which is a screw that goes into the bone that we can put a tooth on. Periodontists are experts in treating oral inflammation, which is very big right now with COVID. They receive extensive training in areas including 3 additional years beyond dental school, as we talked about, familiar with the latest techniques. So there's always new techniques coming out. We have to be on top of them, whether it's equipment that's new that you need. And what's been very helpful is Instagram. The world of Instagram is really amazing because you can see everything that's happening and you can be on top of it because you're constantly learning and seeing things. You treat more problematic periodontal cases. So these are cases that are complex gum disease cases where cleaning, a lot of cleaning, deep cleaning, removing infection from the bone. That's mostly what we do. When you look at Instagram, when you look at social media, when you see all these cool procedures and things that are going on and it excites you, always know that those are the most beautiful things that you're seeing. That was the highlight of that person's week. And he's constantly posting once a week, twice a week. Those are the highlights. That's not what they do all the time. So you have to know what people do all the time. The only way to know what people do all the time is to go and shadow and go literally, you have to work at it somewhere, and then you will see the good, the bad, the ugly, and you want to know everything about any field. And sometimes the way you find out what your way is, what your passion is by the process of elimination, trying out a bunch of different things and seeing which one draws you in the most. So I'm going to show a bunch of cases in a moment, but I in particular, I really like the bread and butter of gum surgery, which is basically you're removing infection, bacteria, people that haven't flossed in years and came in for a cleaning in a long time, basically getting in there and removing that infection, cyst, or the tooth. So let's go to the next slide. And hold on, let me just clean this. Okay. So this is my grandfather, and he was one of the pioneers, really. What you see there, he's holding a drill. Back in the 1940s, they had a type of drill that was like a wheel, and it was like a pulley, and he had a device where on the floor where you kick and you're pumping, and that's what's creating the movement of the drill. And he's since passed away, but this was about 9 or 10 years ago when I had first graduated. My grandfather was 93, and I knew that he was going to pass soon, because he was in his 90s. And I thought, how cool would it be for me to bring him to the office with me and have him assist me. And it was just a really memorable moment because he was my, my inspiration and one of them. And so that's a picture. He would always wear like a coat and tie and, very fancy. So that's him over there. He was assisting me. Next slide. And my brother is also a dentist. You can see he's the one on the left, and my uncle is the orthodontist on the right. And again, these are just some influences that I've had. So research, and wanting to come back to this because I think it's so important to be curious. And right now, as an undergrad, and then when you go to dental school or medical school or any other school, you're learning the notes. You're playing the piano and you're learning the notes, and later on you'll be able to write your own music and be able to synthesize and put things together. And so that's what kind of research is. It's like you have this question like, hey, why da 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 da, why is that? And then you start looking at the literature, and then you start putting together a hypothesis on something and then testing it. And so that's one of the things I do a lot right now. I spend a lot of time on it. And we'll go to the next slide. Yeah, perfect. And my philosophy is that I believe, and I really truly believe, that the oral health is connected to the whole body. And I think that as far the heart is connected to the whole body, right? And the liver is connected to the whole body. And so what's happened is in this country, especially, is we're getting so specialized, right? We have so many different disciplines, so many different organs within cardiology. You have vascular, you have heart surgery, cardiothoracic surgery. You can go into veins. You can, so many different things. When you keep going in deeper and deeper, you lose sometimes the concept of the whole thing and the overall picture and how things integrate and work with each other. So it's good to go in, but you have to remember sometimes you have to back out and look at the whole thing. And so that's what I've done. Now I'm really looking at the whole body. I think that's definitely a movement now, especially now that COVID has happened, and we see that there's all these chronic diseases in the world, especially in America. They just keep increasing. We have heart disease, diabetes, obesity, arthritis, autoimmune disease. All of these are on the rise. For the past 20 years that they've been rising, and projected to increase another 10, 15 more years from now. And if our medicine is getting better and our technology is getting better, then why are people sicker? So that's really interesting thing to consider and be curious about. Minimal invasive approach to treatments. So I like to save teeth as long as possible. And as a periodontist, you're really the person of the office or of your community that decides the fate of a tooth. So when there's a whole big mess, they'll send it to the periodontist to diagnose and say, this has a good prognosis, fair prognosis, or poor prognosis, or hopeless prognosis. And we kind of say you're in and you're out to the teeth. So I don't like to take out teeth necessarily, but and I like to deliver good news to patients, but at the same time, I don't like to keep disease and infection in their body for the sake of making them happier, right? I rather give them bad news and make them healthier than to leave something bad in their body. So it's a balance. So you really have to, weigh those options, talk it out with them. And sometimes you say, let's just get in there and let's see how it looks. It's like a diagnostic procedure that you go in and then you kind of get some more information. Let me see if I can save it, type of thing. Because sometimes people just don't want to hear, that this tooth is is no good, and based off of an X-ray and just looking at it in the mouth. They want to, doc, do whatever you can. Let's see if this has a chance. And with minimally invasive approach to treatments, sometimes the most minimal invasive is to be maximally invasive. Are you guys able to see me?
Yes, we're able to see you.
Okay, perfect. Okay. So sometimes if that makes sense. So someone will do a procedure to be minimally invasive, but it's not minimally invasive if you have to do the procedure twice. And so that paradigm and that thought is not really brought up sometimes in people's minds, that, you know, let's be minimally invasive. Let's do an incision like this big, and let's just you know, not put stitches, and, you know, but if it's going to come back in like 5 years, then what good was that? It's not minimally invasive anymore. It's actually now maximally invasive. So sometimes I do invasive so that it never happens again, and it becomes minimally invasive in the long run. I have embraced the newest techniques and advances in order to give the best possible results. So like I was saying earlier, if I find a new device or new machine, it's a fair game. You buy it, you start using it, and you see better results. The technology usually is for the better. My passion is really to prevent oral complications, and I don't like to just treat the symptoms. So I want to make sure that I get to the root cause of issues. So if there's an extra bone causing the gums to be, you know, inflamed, we have to go there and smooth out that bone. We can't just go and just cut off the bad part of the gum and say, okay, you know, because sure, that will get rid of the problem, but it may come back. So I'm very big on getting to the root cause. I don't like to redo procedures. I like to do it once and do it right and never again, and then educate them on how to maintain it. Because if a patient doesn't keep up afterwards with their hygiene, and you know, people don't like to floss their teeth. It's a thing. I think only 28% of people in a survey said that they you know, floss, and or tell their dentist that they floss. And half of those people, this is a research study, and half of those people lie. So there's only about 13% of people that really regularly on a daily basis floss their teeth. So that's why people, you know, have these issues in their mouth. And just today, just like a couple of hours ago, I had a patient. I explained to him he had, you know, some gum problems, and I told him you need 4 areas of your mouth. We need to lift the gum back, clean out all the infection. And he looked at me like, yeah. I've had it done before, he said, and it came back. I don't like to floss. I'm not going to floss. And so I don't want to do this treatment again because I know I can't keep up with this. So whatever consequences there are. Like, usually I don't get that kind of a, you know, response. It's like kind of like, I know I'm going to lose my teeth and I'm okay with it response. But you hear everything. There's all types of different people. And really part of any field is patient management, knowing how to speak with them. And no one in life wants to be pushed. No one wants to be told what to do. And I can tell you, having kids, when I get my kids to do something, if I get really frustrated and it's just like finally with force that you have to do it because they're not, you know, doing it, and it's been like 10 minutes you're waiting, it always ends up, the little force and pressure ends up in a cry, and they get angry. And so force is not the way to go. You have to educate. You have to explain really well, clearly, with no hesitation, with confidence, with sureness, and with passion that you believe in this. And when you get to their level and explain things that are in their language, they don't want to hear fancy words. It's a turnoff for them. So when they hear you're really one of them, and that this bone that got infected is like wood that got termited, and now we got to get the termited wood out, and now they're with you. Now they're in the game with you. And no one wants to have termites in their house. No one wants to have termites in their mouth. Let's do something about it. Now it hit home. That was the click. So, education, and the right type of education, the right type of explanation is key. And also, again, having to do with the oral health and overall health, we have to talk about nutrition and lifestyle with our patients. And I've been doing that myself a lot lately, and it's really amazing. It's like my new passion. I talk to all my patients, and also I'm taking classes and learning. So 11 years out, and I started this new course, and so I'm learning more, and so about the whole body, and I'm educating patients. And just like my assistant today, she told me, she pulled me aside. She goes, "Doc, could you make my daughter's overweight, and I'm not healthy. I need you to help us out with a plan, because she sees me helping and talking to all the patients, and like literally, it really made me so happy to hear when your assistant and the people around you trust you and see something, and then they trust you to do something like that. It's really amazing. So lifestyle, environment, nutrition. This is going to be a really big part of the future of medicine. And you have to educate yourself to make sure that you really understand it. Because in medical school, dental school, and all these schools, they don't really teach you too much about nutrition and vitamins and all these things. They're not, they go over it, but they're not, it's not really pushed so much. And so, okay, let's go to the next slide. So this is the technology I bring to my office. I have a piezo, which is an instrument that cuts into bone. But if it hits like a nerve, it'll stop and not cut the nerve. So if I go near the sinus, it'll stop and not go through the sinus. So this is a great instrument that I have in technology that keeps me safe, keeps patients happy when they know I have it. Alloderm, when people have gum recession and we don't want to take gum from somewhere else in their mouth, we have this donor cadaver gum tissue that really sounds worse than it is. It looks like a thick piece of jiggly paper that you tuck underneath your gums, and that can bulk up and make the gums stronger and cover the roots further. There's also a lot of biologic materials out there, such as emdogain and growth factors, that really help speed up healing, increase the success rate. And we're living in a day and age where we should be definitely taking advantage and not relying on it, but adding these when necessary. Stem cells as well, drawing patients' blood. Most procedures now, you draw you get PRP or CGF or whatever, you spin the blood, and you can aid in making their healing quicker. I also have, I usually wear some loupes, headlight, so I can see, especially for gum grafts, but definitely you need a good light as a surgeon. And there's this technology I picked up right when COVID happened. It's called magnetic mallet. I was one of the first 5 dentists in California with this technology, and it basically it's like a little jackhammer that controlled only goes 1 millimeter at a time, and it prevents vibration other parts of the head. So you can be trying to get a tooth out around and elevating without with full control, versus like a hammer, you can't really do that. So I could use this for sinus lifts, for implant placement, for expanding the bone, getting a tooth out. So it's been a real big help. I have a camera that goes on the headlights or on my light. I've used it a couple of times, but I do take pictures and videos of a lot of my cases, and whether it's on my iPhone or sometimes on a nice camera. And then the stem cells, the centrifuge machine, which we talked about, but the stem cells, that's a big addition to the world of surgery, really, and healing. All right, next slide. Let me see. Are there any questions so far? Let me see.
We were actually going to take questions at the end of your presentation, so you can just go on.
Okay, perfect. So this is my social media. I was one of the early dentists on Instagram that started posting educational material. I really love it. I like to share what I do, and I have also LinkedIn and Twitter. On Twitter, I've been using Twitter a little bit more now, which I have these ideas a lot. It's like lately more than ever, and I just want to not lose that moment. It's like a good thought, and I'll make a tweet out of it. So these are my handles. Okay, next slide. And Instagram is @dentalsurgeon. I'm also starting up on top of dental surgeon, I'm starting up a new handle that's going to be, I feel dental surgeon is very much for health professionals, although I do have non-health professional followers, but I want to reach out to the non-health professionals. And so I'm starting a new one called Mouth, Body, Soul. And that has to do with a connection of the whole body, from the top really down, everything's connected, mouth, body, and soul. And really from the mouth, I could affect people's whole body and how they feel. So I'm going to be talking about a few different cases. These are the procedures that I do mostly, and that's dental implant placement, which is not as frequent as you might think. I'll do like maybe, there's probably one a day, or, one case at least a day or two, but it's not like left and right all day you're doing that. You're doing a lot of other procedures. I do a lot of gum grafts. So people with gum recession, or people that have gummy smile. I remove gums and contour the bone underneath it, and then we can either leave it or make veneers or crowns on top of it. Treating gum infections, which is probably the bread and butter of our job. Full mouth reconstruction, which is when someone's whole mouth or whole arch is really, doomed and all the teeth need to be removed, and place implants, build bone, and really give them a new smile and teeth. Frenectomy, which is, let's say you have a tongue tie or a lip tie, which is actually really important for not just gum recession or post orthodontic. Sometimes when people are have a gap between their two front teeth, and they go to the orthodontist, and the orthodontist goes to try to move the teeth, and they try to close the gap. Sometimes there's like this little muscle tag that's in the way, that's not letting it close fully. So we'll do a procedure to remove it, and this is a quick, easy procedure where we cut the gum, cut the frenum. Crown lengthening, which is a case I'll talk about here. Ridge augmentation, which is really thin bone and growing the bone to be able to put a dental implant in it. And then salivary testing, which is really amazing. I did a lot of the office I am at today. We do a lot of salivary testing here, and we're able to find various bacteria, pathogens, species, and know exactly what quantities they have in their mouth, and be able to treat it. Because let's say they have something that's like P. gingivalis or so. This is a bacteria that can get into the brain and has been linked to Alzheimer's, or it survives the acids of the stomach, and it can cause a dysbiosis and leaky gut. So this is where we could find out that information is from a salivary test. Send it to the lab, and then have a conversation with the patient and tell them what's going on and what we're doing. Okay, next slide. So basically, first thing you do is, before I get into the mouth and some pictures and cases, I assume some people in here are interested in dentistry. With dentistry, you either love it or you hate it. That's what I've seen. It's either you're really passionate and you love it, or you're in love with something about it. The stability, the hours, the money, the something interests you about it. And then I've seen many people go to dental school. I've seen many people become dentists and then stop. So it's one of the, and it's very expensive, the schooling. So you want to make sure you're on that side of, I love it. And the only way to do that is to get in there and to go and work at a dental office or shadow a dentist, and not just once or twice. I'm not talking about shadow, go for a week even. You have to get in there a little bit. You have to go for a few weeks, a month. You have to really see certain fields, because especially like on your breaks, summer, you have to go to different offices. You have to see as much as you can. And I'm not talking YouTube videos to see what's going on. I'm talking about a day in the life of how this office is and what this person has to deal with. So something that you might not see is people don't want shots in their mouth. People don't want to get numb and be numb for half the day and drool and saliva and spit and lie down and stare at a ugly ceiling. People don't want to do that. People don't like going to the dentist generally. And so you're seeing a lot of people that are in a bad mood, that are scared. Their blood pressure is raised. And you have good intentions to help them, but they have this white coat syndrome where they see you as a doctor and they freak out sometimes. And then if they have a problem in their mouth, they're embarrassed sometimes. So you're dealing with a lot of psychology. So you have to be really good at dealing with that. And you have to be encouraging, and you have to be positive and inspirational to your patients, because they vibe off of your energy. So something I like to do is they don't know if they have a hard case or an easy case. They think that their case is a difficult case, but it's nice for them to, for example, hear like, yeah, I've done 1,000 of these, or I just did one this morning. I had, this is my number one common procedure I do. Don't worry. So they need to feel your confidence when you're, and right away, when I do that, I can hear their sigh of relief, really, because in their mind, they built up this thing, but if it's easy for you, then that means it's going to be easy for them. So just say, yeah, oh, this is going to be easy today. I'm going to make sure you're very numb. So the slide before and this slide basically are showing what a diseased mouth looks like. It gets red, it could bleed. Usually we don't get so much spontaneous bleeding, but we could. It's usually triggered by floss, food getting stuck, one of those. And the gums will swell up sometimes, get puffy. The margin will become rolled. It won't be flat anymore. Like you could see on that central incisor, you could see it's a little bit more shiny and glassy. So versus the lateral incisor, the one in the middle that you could see is more pink and flat. So you can kind of see the difference between that. Now, you can't see, but that tooth that you see on all the way on the left, the one that you can see the whole tooth, the central incisor, that one is actually a crown. It's not their real tooth. They have a crown on top. That's why that tooth has all that redness there and the tooth next to it doesn't. The other tooth next to it, you can see there's a little chip on the incisal edge. And yeah, right there. And so you know that that's aggravated possibly because of a local factor, which is the crown, right? So you have to really use deduction and look at other teeth. You have to look at the whole body, okay? By that, I mean, what medications are they taking? Sometimes they're taking cyclosporin or anticonvulsants like phenytoin, or they're taking a blood pressure medication, calcium channel blocker like nifedipine. And these are patients have more chances of puffy gums, and they can't react to plaque, or people that their immune system is compromised, people that have HIV, people that have any kind of autoimmune disease. Anytime your immune system is compromised, it means your body can't go and fight the plaque, the bacteria. Plaque is that thing when you scrape your teeth in the morning and you get that white stuff off, that's plaque. So that's what it's all about. That's the biofilm. We want to make sure that that's not calcifying and hardening and getting stuck. So next slide, please. So there's really the shift and of a paradigm, and it's been going on for like years, 20 years, 30 years, but it's getting more popular now. And the connection is really between the gum disease, bacteria. There's a lot of blood vessels in the mouth, and those blood vessels go straight to the heart. Then they get pumped all throughout the body. It only takes 60 seconds for that bacteria in the mouth to reach the foot. That's how fast our circulation flows in our body. And because of that, there's a higher increased chance of people's kidneys having problems. A 10% increase in gum disease is a 3% decrease in their kidney function. There's a 2 times higher chance of heart attacks and strokes. There's an increased chance of cancers. when people do get cancers, it's the more aggressive ones like pancreatic cancers, colon cancers, lung cancers, when they have gum disease. And in my paper, and then it's been, so again, my paper connected it with COVID. I basically said that there's a increased severity of COVID when you have gum disease. About 3 weeks ago, there was a publication that confirmed my study that was on hospitalized patients, and they showed that basically if you have periodontitis or bone loss, and they looked at people that died in the hospital and went to the hospital, and they looked at their gums, their periodontal disease, and they saw that there was a 3.5 times chance higher of going to the ICU if you have gum disease. So that was what the study, so it confirmed my study. And now I've been contacted by a radiologist in England, and we're writing a paper because we actually think that COVID is not a fully respiratory disease, and we believe that it's going to the lungs, not via the nasal, oropharynx, esophageal, pathway. We think it's a vascular one, and we're writing it all up to show that it is possibly, it's a hypothesis that it's coming into the pulmonary arteries via the gums. So this is new information. You guys are the first to know this, but that's where I'm heading with my research, and that could be a really big game changer, because once you know a pathway, once you know how things move, then you can prevent, right? So now all of a sudden, if this is true, dentists become even a more important team member in the challenge and fight against COVID-19. All right, next slide, please. So there's a difference, and we want to kind of know what chronic inflammation is. So we have chronic, meaning it's versus acute. Really, acute means something is more of like a exacerbated an abscess that's alive and well and vibrant and happening and an emergency, and so something that just happens, that acts up. Chronic is something that's always happening. It's on the, and your body is adapted in a way that it just has to just live with this. So it makes its adjustments, and so when you get chronic inflammation, and it could be anywhere, it could be from obesity, an increase in LDL and the cholesterol, leading to a breakdown in insulin, and the pathway of leading to diabetes and insulin resistance. That can cause inflammation chronically, and it could be in the gut and leaky gut, and it could be IBS, irritable bowel syndrome, and so many issues that we can have in our stomachs and our gut cause us inflammation. And it really, it's a permeable leakage of a tissue leaking bacteria and toxins, and these toxins get into the bloodstream, and then they go all over the body, and then they can cause a cascade and upregulation of all sorts of other pathways that can cause more pro-inflammatory cytokines. So one of the things that we see is that if someone has gum disease, that they have higher chances of obesity and diabetes and all sorts of things. And then we see also that when you fix not fix, but really treat diabetes and get their A1C under control, their diabetes numbers under control, they can have a better outcome with their gums, because now their bodies can fight better. So everything goes hand in hand, and everything is connected. So one of the goals is to decrease chronic disease in the whole body. And so you have to have not just one approach. In my instance, it's not just from me telling them and getting their gums under control, but it's, hey, you have diabetes, you have, and I see this all the time. Like, and by all the time, I mean a few hours ago. This is happening. This is America. This is the world that we live in. We have a new world where we go to a supermarket and you can barely find any organic food anywhere. There's all these preservatives in the food. You look at the back of different foods, packaged foods, and you can't pronounce most of the names on the back. That means it's probably bad for you. And so that could increase your omega-6s and throw your whole omega-3, omega-6 pathway out of balance, and that could lead to inflammation. So there's so many different ways inflammation could happen, and you can get it from not sleeping properly. You can get it from drinking alcohol. You can get it from stress, and so many more ways that this can get triggered in our body. So let's go to the next slide. So this is really a CT scan. If you want to hit play, it's a video. So this is a CT scan. You can see really one of the first things we need to do as doctors is diagnose. We need to be able to see three-dimensionally what's going on in the jaw, in the body, and really in the whole face, sinus. So this person's missing a front tooth. You can see there's a wisdom tooth even there impacted. We're going to go in and you can see the soft tissue would be around there, the gums, but this is only the bones that you see. Now we're going into this is an implant that's being placed into the bone. You want to make sure that you have bone all around the implant. And it's just an amazing tool, the CT scan. We can see, diagnose, plan what size, shape, do we need to do a bone graft or not? Do we have enough space for an implant? What size implant? And we can see the TMJ. We can see right now, that's the tongue. You can see the airway. If someone is obese, you can see how much airway they have from a CAT scan. So all sorts of things. You can orthodontists use it to diagnose the different angles, protrusion. So that's a CT scan. Let's go to the next slide. So when you don't have enough bone for that implant that was in that front area, we do what's called a ridge augmentation. So as you can see on the top left picture, there's a dip in the bone, in the gum, which means there's less bone possibly, and not enough bone to be able to put an implant there. The other option here would be to do a bridge. And that's actually, in this picture, you can see that we're removing a bridge and putting an implant and growing the bone for an implant. And so I put a tenting screw on that lower. First, we put some holes. And in surgery, we create bleeding. It's a controlled bleeding on purpose to be able to bring in all the cells we need to grow bone, to give life. Blood is life. And with blood comes a lot of healing cells and stem cells and growth potential that we can give life back to tissues like gums and bone. And this is basically just, common procedure. And these are silk stitches that were put. Sometimes we put different types of stitches. The picture on the left is called a membrane. It's something that we put over the bone to contain it and help and not let the gum tissue go into the bone. So it excludes epithelial cells, and the term for this is guided tissue regeneration. All right, let's go to the next slide. So this is a full mouth extraction and immediate implant case where I put 6 implants on the top and 4 implants on the bottom immediately. And I remember this was one of my early years. Took out this one patient. He had really bad gums, and he wasn't that old, and some health issue that he had to remove all of his teeth. So his bone wasn't all that bad, and we were able to place enough implants to give him a new smile. I haven't heard from him in a long time, which usually is good news. It means that they're happy and nothing's going wrong. Next slide. This is a tooth on the upper left that it's actually to the 2 front teeth. And you can see there's all this bone missing, infection. These teeth are very loose. There's barely any bone holding them. And I took out those 2 teeth. I removed all the infection. I packed a lot of bone, and you can see I came back on the upper right picture. We had enough bone to be able to place 2 implants. Those are the holes for the implants. And then the bottom 2 are the actual implants put in. And then you can see the x-rays, and you can see all the bone that's grown back. And it's pretty amazing that we can do that. And even kind of vertically get some height back on bone. All right, next slide. Osseous contouring. So a lot of times we and I want everyone to stay till the end because I'm gonna be more interactive a little bit and have something good to say for you guys too. But you can see this person, they have a really bony smile. So you can see that's all bone. The jawbone is abnormally wide, and so that can cause even facial protrusions. Like you can see in these people that looks like they're they have something in their mouth. And so no one really diagnoses these things. So these people will go for years and years. So and they have a gummy smile. They mouth breathe because they can't close their mouth. So because they mouth breathe, now they get a lot of cavities and gum disease. And so imagine you can just get to the root cause, remove this bone. They look better. They have less of a gummy smile, and really a good service to patients. But most dentists, sometimes they see this, but they look at a tooth and they may miss it. So it's good to educate in kind of your colleagues so they know what to look for. Okay, next slide. And this is a video. This is implants I've had placed, and I took out also, I took out 3 teeth, and then I immediately placed implants, and you could push play, I believe, on there. Yeah. And then I'm putting in a bone graft into the socket, and that's basically bone powder that's going in. And this is just taken with my on my iPhone back in the day, probably like an iPhone 3 back then. But you can see That's the membrane going over. And then these are the sutures to close up. These are dissolvable stitches. Chromic gut is the name. And I'm suturing, and I'm gonna get primary closure. I want to get really good closure over those implants on this. And because we have to come back anyways to place implants, an implant and the one that was taken out. So that's the 2 implants. And then on the right of it is the area that we put the bone. So that's like a typical case. Sometimes we're able to put the implant at the same time and sometimes not. Next slide, please. Sometimes problems happen. Implants get damaged and we need to take out an implant. So this is that instrument I told you about, the piezo. I go in and I'm able to go around the implant, tease it, removing some of the bone. I don't want to remove too much bone because it's precious bone that we need for a future implant. So you got to be very careful, rotating the tooth in a circular motion and really kind of backing up and unscrewing, reverse screwing that the threads, because it makes a thread in the actual bone. Implant is out. You can see it's damaged. New implant was placed immediately. Bone was placed over that, closed over, done. So that happens from time to time. And usually periodontist is the one that deals with implants gone bad. Actual screws gone bad and disease around screws. Implants have been around. It came into it came into California in the late 80s. Really got popular in the 90s and 2000s. A lot of people who had missing teeth, they had missing arches, there was a lot of advertisements. So people have gotten implants. And so the market is not the same as it used to be in one aspect, because a lot of missing teeth have been replaced now. At the same time, there's a lot of general dentists that place implants as well. So just like life, you evolve, and there's the profession evolves every 10 years, every 10, 15 years, something new comes, there's new movements, new changes. And so you can't, and this is what I wanted to tell you guys, you can't look at what a field is right now also to say if you love it or not. You have to kind of be able to predict what the field is going to be like in 10 years. And I can give you an example. In my dental school class, there was a lot of people, all the top people in the class, the top of the class, your goal was to become an orthodontist. And it's a good job. Everyone, as a kid, people got braces. It was fun. You see the orthodontists, they're happy always. And, so it's not like you don't think of it as a very difficult job, especially since the assistants do a lot of the job, but they use their mind a lot and they have to do a lot of planning. So that was the most competitive back then for orthodontists. Now there's computers that are moving teeth. You take an impression, the patient from home, there's a company that sends a tray, you take an impression from home, you send it to them, they make you the aligners, and they put it in, and they're able to move teeth gradually. Not the best way to do it, in my opinion, but it's a way to do it, and it's disrupted the market in a way, and it cuts into the profit of the market share really of that industry. And so you have to think about all aspects of every field, because you have to think the future is going to be everything digital. So can your profession be next? And if you think that your profession is safe, you have to think again, because you haven't thought of the way. Almost everything is, there's robots doing surgery. There's ways. So there is a question here. I just want to answer. Do you believe orthodontist industry will decrease? Do I think it's going to decrease? It has already decreased, is the thing. So, but the thing is, it maybe has decreased for orthodontists a little bit, but it has increased for dentists, because now dentists could also do Invisalign more too. So if you're a dentist, then you could win off of this. It's a win for you. But if you're orthodontist, maybe, it may not be the best. And I'm going to talk to you guys in a little bit, because more further about this, because I actually, that company that I started was called Synergy Specialist. Now it's called Periodontal, and I'll talk about it a little bit more. We are now one of the biggest, marketplaces for dental specialists. So I actually know all the numbers and what specialties do the best financially. And I know, which ones are in the most demand, which ones are the hardest. I have a pretty good grip on it. I actually have a very good grip on it. But so it's really, at the end of the day, and I always tell people this, it's, if one profession makes 10% more, 20% more, doesn't matter. You got to do what you like. Because it doesn't matter if you have 20% more and you're not loving it. So, or that's not you, that's not like your thing. Like, I know people that like wanted to become some profession, and they are very smart, actually. These are really smart people, but they didn't get into that profession. They didn't get into that residency. They weren't, so they went to another one. There was a second choice, but there's, let's say like one of them is like ophthalmology and the other one is like orthopedic surgery, And so, one, you're in one small area, the other one you're doing bigger, you would be miserable in a way if you're just sitting there and like, with a microscope and only looking at like, millimeters of space. And so do what you like. You will make more money if it's that you like. If that's what you want out of life, then you will do more better. But that's my advice on that. All right, next slide. All right, we saw this. So that was the implant removal. So this is I'm contouring the gums. First you can see I cut away some gums, because those excess gums. Now I'm trimming it and I'm making it thinner. So I'm just doing it. This is fast forwarded really quick, and you can see I'm kind of just going very slowly with the blade, very carefully at a certain angle to make sure I don't cut into the gum, cut a hole in the gum. So this is before. You can see it's very gummy. This is right afterwards. Flat, remove the gums, that was that. These patients, and makes you feel good, okay. Are you able to go to the next slide?
Can you see the screen?
Yeah, have you went to the next slide? Oh, there we go. Okay. All right. So this is my setup. Like when I'm doing one of these gummy surgeries, I use a lot of blades. Yeah, so this is that case. And and this is actually a manager of one of the offices I go to. You can see this is with her new veneers, no more gummy smile. She's so happy, you know, getting rid of that. Most people, again, most people don't know that that could be done. And then always you hear people say, I wish I knew about this earlier. So again, it's mainly females that have gummy smiles. And happens in about 12% of the population. There's some sort of a little gumminess. A little bit of gum display is actually nice and healthy and good. We recommend, you know, usually about 2 to 3 millimeters of gum display when they smile, upon smiling. And more than that, the studies have shown it's unattractive to people, but to each their own. Some people like a gummy smile on their spouse. So who's to say? All right, next slide. All right, so again, this is how those kind of cases look like. You can see on the left, you can see this one. It's on the left. There's so much bone. Do you see on the top? There's all that bone poking out, and by just contouring that, you can get it to be flatter and in harmony with their smile. Their lip on the right side, on the bottom one, you don't see their lip, you know, bulging anymore. It's actually a fuller lip, and there's it just looks more it looks so nice, the difference between the two. And she didn't do anything. We didn't touch her teeth at all. So those are her natural teeth. And that was a recent case I did actually not too long ago. All right, next slide. And I love those procedures. They take a long time. I block out a good amount of time for that. And so this is a accelerated orthodontics. It's not done that much, but it is done where we take a piezo, that piezotome, what I showed you, that instrument, and you can go around the teeth. So this can accelerate braces by more than double the speed. So if something was going to take 2 years, it can take like 8 months. Or, you know, so that kind of a speed. You put the brackets on, refer to you know, a surgeon, and we make these cuts into the bone around the teeth. And these are controlled trauma, basically, where the teeth get this phenomena where it's a acceleration of the blood that flows to the area afterwards. It can give the teeth get a little bit, you know, mobile in a way. And then the teeth, all of a sudden, the next day, you can put the braces on, and boom, you'll start to see within the first month, you'll start to see a good amount of movement. So this is a case that's usually done with challenging ones when you want to move the tooth into the bone. So the upper tooth, you want to move up, and that would be called intrusion. You want to intrude a tooth, which is not an easy movement to do. These are good cases. Or someone wants to just speed up their case, which is sometimes people do it just, you know, they don't want to be in braces for 4 years. They rather be in it for 1.5 years or a year or so. So, you know, so that's accelerated orthodontics or corticotomy, and it's usually a periodontist and a orthodontist working together on this. Sometimes we don't have enough bone in the height in the posterior of the maxillary jaw back here. There's a sinus over here, so we have to do what's called a sinus lift, and we create a window right there, right on the top of the implant. There's a little window that's created, and we have access to the sinus where we can lift the sinus very gently and put bone particles, usually cadaver bone particles we can put and pack it in, and it will keep the sinus membrane up. And then the implants, usually the implants aren't placed the same time. Sometimes they could be. And then you can see on the lower right, all of a sudden you can go from 2 or 3 millimeters of height to all of a sudden, a good 10 to 12 millimeters of height and place implants. This takes about 6 months at least for the bone to mature and get strong before the implants can get put in, or loaded, I should say. Next slide, please. This is on the mandible, on the lower jaw. This is an extra bone that was removed. So you can see, yeah. I don't know if there's sound on it, but you can hear a click. It does a nice pop sound. Pop right there. So that's just bone. That's good bone. Actually, we can use that bone for bone grafting and ridge augmentations, and so sometimes we borrow bone from the patient. We don't need to get it from a cadaver. All right, next slide.
Sorry.
Yes.
I want to interject real quick. Our session is supposed to end around this time. If you'd like to go on for a few more minutes, that's okay. I don't want to cut you off, and I'm sorry, because I'm learning a lot of really valuable information, and I'm sure everyone else is.
Sure. How much time do we have?
Well, we actually went a little bit over, but we can stay like another 10 minutes or so you can wrap up.
Okay, I'll wrap up. Okay.
Yeah. Thank you.
I'll go fast. So basically, this is a complication. Not really. Sometimes these things happen after a procedure. It's just some extra blood that's there and gets removed, and you could just wipe it off. But patients will freak out and call and say, "Well, what's going on?" But that's just a blood clot that happens after some procedures. Next slide. This is a ridge augmentation that you can see. That's like a little saw that you're cutting into the bone, and you can spread the bone and make it a little bit wider. So then put an implant in after. Next slide. This is a procedure I did actually a couple of weeks ago. This is someone that has gum recession. I took gum from the palate and I put it in that area in the front. And I wrapped around the other side, on the left side, on your right side. And those are not dissolvable stitches. And I know him. This is he used to be one of the managers of one of the buildings I work in, which goes to show, like, a lot of the people that I've put on here and a lot of people that I've been talking about, they're people that I know, some people that it's a really good feeling. Again, like going back to that when someone trusts you with their mouth. And this is actually, I placed his implant. There was an implant within this that I had done a long time ago for him too. Next slide, please. This is what we see a lot. This is an aggressive bone loss. There's a hole, basically, that infection that burrowed through on that root, and lift the gum back, clean out the infection, detoxify and clean it, decontaminate, put some bone, put a membrane, close it up, and then we can grow some of that bone back. Next slide. And I do a lot of this. Again, this is like one of the procedures. Gum disease is what we do all the time, all day. This is someone who has extra bone. Again, on the top, you can see it's this like wide bone that's protruding. That's a bed where bacteria can hang out. And then I polished it. I made it smooth. On the lower right, you can see there's a tartar. See that dark area? That's a tartar. That's on the lower right there. That's a tartar right there. So that's not good. We have to remove that. That's where all the bacteria live, and that's that's the source of the problem. Next slide. This is a bridge that actually you can see how flat on the left side. See that tooth where it says referred for extraction? This was sent to me for me to remove this tooth. I said, wait, I think I could save this tooth. So I lift the gum back, I remove some of the gum, I remove some of the bone. It's called crown lengthening. And now all of a sudden, if you look at the lower right picture, now we have more tooth to be able to put a crown on top of it. Next slide. Again, this is an implant. You can see in between two teeth. So sometimes people with bridges, they don't like bridges. They want to floss in between their teeth. They'll come in, we'll remove the bridge, we'll put an implant. This is it's called sticky bone. I actually use this today on a patient. So we draw blood from a patient, we spin it in a centrifuge, and we can get, again, the concentrated growth factors from their blood, mix it in with the with their bone, with a cadaver bone actually, and it turns into the sticky bone that heals quicker, that's more stable, doesn't move around, and it's more, the body identifies it more with itself. Next slide. So my typical day at the office is I do a lot of consultations. I'm educating patients about oral systemic connection, body mouth connection. I cooperate a lot with general dentists and hygienists. You have to be really social and really communicate with the whole office, the front office, the staff. Typical busy practice, you have at least 10 to 20 patients. It could be in a day. Average, I'd say it could be 15, which is a lot. I have pretty busy days, doing at least a few surgeries a day, and patients come in for post-op where we remove stitches, and at the end of my day I do chart notes. It takes about like 40 minutes or so, and a lot of treatment planning, text messages with other doctors throughout the day, asking about cases, and sometimes I get to have a little bit of a lunch. I'd say 30 minutes to an hour. Sometimes it could be like a 10-minute lunch, but most of the time I like to take a little break. It's healthy for our health. All right, next slide. The pros and cons of kind of what I do is traveling. This is, I'm a traveling specialist, so I go to different offices, and that's what Periodontal does. We have offices, general dental offices, that want to bring in on a once a month or twice a month, line up their patients, and you can come in and do those procedures. That's what I do. The pros and cons are you don't get bored. You go to different places. So that means at lunch, you're eating at different places all the time. You're different people. So that's kind of cool. Different cities, different vibes constantly. You have all these different secretaries kind of working on things with you. And so that means you have more manpower in a way to build your schedule. You get to do more cases earlier on in your career. Whereas if you want to open up your own office or be an associate, you're not doing as many cases in the beginning. This is like 0 to 60 real quick. You go to an office, you're doing all the perio out of that office. Or if you're a root canal specialist, the same thing. You're doing all the root canals of that office. You're doing all the extractions. So this is great when you graduate. And like me, I've been doing this for almost 11 years. I think as a specialist, having a practice, your own practice, is a thing of the past, and it's the rise of teams and the team approach. That's the future. The cons: it's hard to have a time off, and you have to scheduling time off is really hard, and you have to plan for vacations in months. You don't have a lot of flexibility over who you're working with every day because you're not hiring them. So it could be frustrating sometimes working with people who are just a little bit slower, or may have a bad attitude, or just lazy. So next slide. So this is the company I co-founded with my cousin, Dr. Alex Molayem, and a really good friend of mine, Darius Samikian. And we match dental practices with offices, and we are, we set up from A to Z, really for the office, training the staffs and everything. So if you want to check it out, it's called periodontal.com. All right, next slide. I also invested in a company called Dentulu, and this is I was the first investor, and it's a company that is the world's first mobile teledentistry app. So you can talk to a dentist on demand anywhere in the world, and it's with COVID. I actually invested in this before COVID, so they've been really kind of busy building technology this past year, and really excited about this because they're able to do so much to help people. For example, in Texas, when this past couple of days, this past week, there was a storm. Dentula was able to offer some services for free for people who needed to get to the dentist. They have a humanitarian aspect to the company. So the future is very bright for this company, and it's pretty much dentistry on your cell phone, anywhere you go. Check out their website, you'll see what I'm talking about. And next slide. Some advice I have for you guys. You got to be really good at reading comprehension. So if you're reading something over and over again, skip it, move on, go to the next thing. Okay, don't get caught up in that one sentence or two sentences. Okay, put a question mark, put a thing out, come back to it later. Keep your flow going, keep your momentum going when you're studying. Okay, I was a very good strategic studier, and I would always, so I have a lot of good advice on studying. Get tutorials that will aid on the taking tests. So you want to go on the internet and see what you could find, what Cliff Notes already, short versions people have. Highlight the keywords. When you write on your notes, you remember when you go back, oh, that's what I meant. And get a mentor. Get multiple mentors. The mentor doesn't even have to be a mentor. It could just be, they don't need to know that you're a mentor. Just someone that you like, that you want to emulate. Try to copy success. Have a nice work-life balance. And do not spend so much time finding answers as most of the time you might not get them. Okay, let's go to the next one. I don't know exactly what I meant by that. Okay, next slide. All right, so quotes and mottos to live by. Basically, you guys are in the very early stages of your career. You have to keep the end in mind. Okay, keep the end in mind. There's a light at the end of the tunnel. You're gonna be like, oh my God, 4 more years. Oh my God, 2 more years. 1 more year. Just trust me, it's worth it. It's gonna pay off, and you'll be able to be financially, free, and do things that you want to do with your life later on if you work hard now. Give unconditionally, no matter what. You got to give. If you want to get, you have to give because it feels good to give. So give, collaborate, don't compete. Work with others, don't compete. Give things to people, share your notes with people. Who cares if someone else gets a better grade than you on that test? There's 30 other people in the class. Well, whoop-de-doo. But you made a good friend that might help you later. And just get in that person, get in that mode of helping and giving. Okay, it's gonna come back, and you're gonna see later on in life. I have multiple examples I can't get into, but it's been even in my dental school class. The first test, I had these study notes that was given to me by someone from the year before. I Xerox copied it and I gave it to the whole class. And from then on, everyone started helping each other more. So you could make a difference, and one person could make a difference. An ounce of prevention is worth a pound of cure. Benjamin Franklin said that. You want Hello? Could you guys hear me?
Yes, we can hear you now.
Okay. And I personally, I like to have a functional approach, more natural vitamins. You want to make sure you're taking care of yourself and exercising, working out. Don't neglect yourself. Get your sleep. I know some people can get better work done at night, like late at night. Sometimes it's better to just call it quits, go to sleep, and instead wake up early and set your alarm 2 hours earlier and study before a test. It'll be better. The information is more fresh in your head versus getting bad sleep and waking up early and you don't even remember what you did at 1 a.m. anyway. So don't do this for the money or you will be miserable. I've seen it. And lifelong learning. Always keep learning, always keep the drive for learning. And next slide, I think is there. So if there's any, actually one more thing, as Kobe Bryant said, he said that the journey is the journey, not the destination. So live in the moment, be in the moment. It's the journey. Okay, this is you're living it already, and before you know it, you're 40 years old and 60 years old, and and then you're always going to be like, oh, I wish I am, and you just right now you have a lot. So be thankful, be grateful for your health, for your family, and let your. I heard this quote the other day and I really loved it. Let your profits fuel your passion and your passion fuel your profits. And with that, thank you guys so much for tuning in and listening to this talk.
Thank you so much for joining us today. You had so much information and it was really great. I got a lot out of your presentation. I'm sure our students did as well. So thank you for joining us. I'm so sorry that we didn't have time for Q&A, but we would love to hear if you ever want to come back or if you want to connect with students in another way, we would love that.
That would be great, definitely. If anyone is interested, since I do a lot of research, if anyone is interested in doing research, I am an editor of a journal and I been publishing pretty frequently. This past year we had 4 publications. So if anyone is interested, I could use the help. You could email me or reach out to me, and I can put you in touch with my assistant, who he can organize and everything. We can get a project going.
Thank you so much. Okay, for my students here today, thank you. I'm going to go over a quick wrap-up presentation to let you guys know how you can get your certificates and everything. Thank you for sticking this out and hearing the rest of that amazing presentation.
Thank you, guys. Have a good night.
Thank you. You too. Okay, everybody. So just a few quick things to think about. Let's reflect for a second if we can. What brought us to our session today? What are 3 major takeaways that we got from the presentation? And what do we want to learn more about? This is not required writing or anything, but if you would like to share some of your reflections today, we encourage you to submit it to www.prehealthshadowing.com/blog submissions, and our editor-in-chief, Moon Saha, will go ahead and take a look at that for you and give you some feedback, coordinate how you can get that published. And if a great opportunity to go on your CVs, resumes, applications, etc. So we'd love to hear it. If you're interested in being a part of pre-health shadowing, you want to get more involved in our program, we definitely encourage you to visit our website as well. You can come to be an asynchronous volunteer and do work and get volunteer certified hours from home at your own time, at your own pace. If you want to have a more active role in our organization, we also offer the chance to be a team member, and you can be up here with us and lead your own projects, coordinate with a team, and just get in touch with like-minded students from around the world. So once again, real quick, we humbly ask that if you can, you donate, because we are a student-run nonprofit and we run fully off of all of the hardworking members of our team who are putting in hours, 1 hour each week, despite being full-time students. So if we can keep our Zoom up and running and our website up and running to continue to give students these opportunities to connect with professionals, to connect with other students, and to get access to free resources, we do definitely encourage you guys to at least share this link with people who you think can help support our program. Okay, now for the moment that we've all been waiting for, how to earn your digital certificate, verifying your virtual shadowing hours for coming to our session today. So first things first, you're going to visit our professional course page at prehealthshadowing.com, and you're going to sign up for free for this course if you have not already. You are then going to click take the quiz, and you are going to take a multiple choice 10 question quiz. It's entirely based on the content from the session today and the things that the doctor went over and things that our professional covered. You don't need to know serious medical terms or anything. It's pretty straightforward. If you're paying attention, you'll get it. We just want you to pass with 70% or higher. You get 2 tries and 30 minutes per attempt to take the quiz. We have had website issues in the past, though, with too many people logging on at one time. So I do recommend that you wait about 30 minutes, 45 minutes until after the session after the Zoom ends in order to go onto the website and take the quiz. But it is open indefinitely. You can take it whenever. You take it now. You take it in a month from now. You take it in 3 months from now. It's still going to be there. You'll be able to take it. It's okay. So yeah, once you do that and once you pass your quiz, you can go ahead and you click finish course and download your virtual certificate. If you have any questions about that, feel free to email us at info@prehealthshadowing.com, and we'll be happy to assist you any way we can. So if you missed part of our session today, or you have missed any of our other previous sessions, you can find us on YouTube at Pre-Health Shadowing, or you can find all of our archive sessions on prehealthshadowing.com, where you can additionally take those pre or post shadowing assessments and just back up those virtual shadowing hours. It's awesome that we have been able to we've done like 50+ sessions, and so you can go back, find the specialties that you're interested in, and see what those professionals have to say. But if you like joining us in real time, we highly encourage you to follow us on social media and sign up for our email list so you can be sure to catch our weekday sessions, which we have every single weekday through June, which is awesome and amazing because we have so many different professionals lined up for you guys. So highly encourage you to register in advance. So thank you so much for joining us today. I appreciate all of those who stayed despite going over our initial time. But if you have any questions, feel free to stick around. I will be here along with the other members of the team to answer anything. Otherwise, this virtual shadowing session is officially over, and I hope you all have a great night.